So I'm going to just show you what it is that I talk about with the patients when I explain how to use the gel masks. And where this information comes in the course of the surgical counseling would be, we usually start out by reviewing the procedure and going over allergies and medications, and then we talk about their pre-op instructions. I usually kind of wrap up the pre-op instructions with a reminder that the patients are not supposed to have anything to eat or drink after midnight, the night before surgery. And then we move on to the post-op instructions. And I start out my post-op instructions talking about the gel masks, and I'm just going to go over exactly the way that I tell patients how to use these gel masks. So what I let them know, after surgery, we like for you to have something cold to put over your eyes. These will help reduce the bruising and swelling that occur after your procedure. Ice is a little harsh for the eye area, so we want you to use these gel masks. I'm going to send 2 gel masks home with you. These just require refrigeration, so usually I let people know that when you go home, you can just tuck these right into the refrigerator. That way they will be ready for you to use as soon as you get home from surgery. Just don't open the packaging. Once you open the packaging, they do start to dry out a little bit. But what you're going to have when you get home from surgery, you are going to have this soft little gel mask. They are in a plastic tray like this. It's a soft, pliable mask. They are the same on both sides, so it is not going to matter which side you apply to your skin. What you do with these masks when you get home from surgery, you're going to pull one out of the refrigerator, and it takes them about 10 minutes to change temperature. So pull one out and apply it to the eye area. You leave it there for about 10 minutes, and then you return it to its tray, and return it to the refrigerator because they are reusable, and you're going to pull the other one out and apply that one for 10 minutes. We would like for you to use these masks back to back all day long, the day of surgery, and then at night before you go to bed, you can just slip them in a Ziploc bag and leave them there overnight. And then for the next 2 or 3 days after surgery, just use them as much as you are able to. The more you use them, the less bruising and swelling you're going to have. A couple of things to know about the gel masks. If you do have even a slight amount of bleeding after surgery, these may get a little pink tinged. Please don't be worried about that. It's not going to hurt them. If it bothers you, you can rinse them in tap water. Just don't use any soap because that will start to break down the silicone. Also, if it becomes kind of a chore to get up and down to the refrigerator every 10 minutes, you could get a Tupperware and put some ice in it or a cold pack. Just set your trays right on that the cold pack or the ice. That way you can keep it right next to you and you can be swapping them out without getting up and down to the refrigerator every 10 minutes. I think that's it.